Zenzedi is a medication used to treat attention deficit hyperactivity disorder, also known as ADHD. It works by changing the amounts of certain natural substances in the brain, which can help increase your ability to pay attention, stay focused on an activity, and control behavior problems. It may also help you to organize your tasks and improve listening skills. In addition to treating ADHD, Zenzedi is also used to treat a certain sleeping disorder called narcolepsy, helping you stay awake during the day. It's important to note that Zenzedi should not be used to treat tiredness or to hold off sleep in people who do not have a sleep disorder. The daily dosage and optimal timing for taking Zenzedi should be determined by your doctor based on your specific condition and needs. Before taking Zenzedi, be sure to read the medication guide and, if available, the patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take Zenzedi with or without food as directed by your doctor, usually 1 to 3 times a day. The first dose is usually taken when you wake up in the morning. If more doses are prescribed, take them as directed by your doctor, usually 4 to 6 hours apart. Taking this medication late in the day may cause trouble sleeping, insomnia. If you are using the liquid form of this medication, carefully measure the dose using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. The dosage is based on your medical condition and response to treatment. Your doctor may adjust your dose to find the best dose for you. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. During treatment, your doctor may occasionally recommend stopping the medication for a short time to see whether there are any changes in your behavior and whether the medication is still needed. If you suddenly stop using this medication, you may have withdrawal symptoms. To help prevent withdrawal, your doctor may lower your dose slowly. Withdrawal is more likely if you have used Zenzedi for a long time or in high doses. Tell your doctor or pharmacist right away if you have withdrawal. Though it helps many people, Zenzedi may sometimes cause addiction. This risk may be higher if you have a substance use disorder. Do not increase your dose, take it more often, or use it for a longer time than prescribed. Properly stop the medication when so directed. When this medication is used for a long time, it may not work as well. Talk with your doctor if this medication stops working well. Tell your doctor if your condition does not improve or if it worsens. Possible side effects of Zenzedi may include nausea, stomach upset, loss of appetite, dry mouth, headache, nervousness, trouble sleeping, sweating, weight loss, irritability, and restlessness. These side effects may go away as your body adjusts to the medication. This medication may also raise your blood pressure, so it's important to check your blood pressure regularly and let your doctor know if it's high. It's important to contact your doctor right away if you experience any serious side effects such as changes in mood or behavior, uncontrolled movements, swelling in the ankles or feet, extreme tiredness, or significant unexplained weight loss. In rare cases, Zenzedi may cause a very serious condition called serotonin syndrome/toxicity. This risk increases if you are taking other medications that also increase serotonin. It's important to seek medical help right away if you experience symptoms such as fast heartbeat, hallucinations, severe nausea or vomiting, or unexplained fever. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, or trouble breathing, it's important to seek medical help immediately. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. And remember, if you have any concerns or questions about the medication or its side effects, always consult your doctor. Misuse or abuse of Zenzedi may lead to serious heart and blood pressure issues, and it can be habit-forming. It's important to use this medication only as directed by your doctor. If you use Zenzedi for a long time, you may become dependent on it and experience withdrawal symptoms when you stop taking it. Be sure to consult your doctor or pharmacist for more information about how to use Zenzedi properly. Before taking Zenzedi, it's important to talk to your doctor or pharmacist about any allergies you may have to it or other similar drugs. This medication may also contain inactive ingredients that could cause allergic reactions or other issues, so be sure to discuss this with your pharmacist. It's important to inform your doctor or pharmacist about your medical history, especially if you have any blood circulation problems, certain mental/mood conditions, heart problems, high blood pressure, seizures, or a history of substance use disorders. Zenzedi may also make you dizzy, so it's important to avoid alcohol or marijuana while taking this medication. For children, this medication may slow down growth and cause weight loss, so it's important to monitor these effects. For older adults, they may be more sensitive to certain side effects like chest pain, trouble sleeping, or weight loss. If you are pregnant, it's important to discuss the risks and benefits of taking Zenzedi with your doctor. This medication may pass into breast milk, so it's not recommended while breastfeeding. It's also important to inform your doctor about all the other medications and products you use, including prescription drugs, non-prescription drugs, and herbal products, before having surgery. When taking Zenzedi, it's important to be aware of potential drug interactions. This medication should not be taken with MAO inhibitors, and you should also avoid using other drugs that increase serotonin levels, such as certain antidepressants and street drugs like MDMA. Additionally, products containing amphetamine or lisdexamfetamine should not be used while taking Zenzedi. It's also important to inform your pharmacist of all the products you are using, as some may contain ingredients that could affect your heart rate or blood pressure. Furthermore, Zenzedi may interfere with certain medical tests, so it's crucial to let your healthcare providers know that you are taking this medication. As always, it's essential to follow your doctor's instructions and not make any changes to your medication regimen without consulting them first. If you believe someone has taken too much Zenzedi and is experiencing serious symptoms like passing out or trouble breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can call 1-800-222-1222, while in Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe or persistent headache, drastic changes in mental state, seizures, extreme restlessness, or rapid breathing. It is important not to share Zenzedi with others as it is against the law. Your doctor may also conduct lab and/or medical tests, such as monitoring blood pressure, heart rate, and growth in children, while you are taking this medication. It is important to attend all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Zenzedi, take it in the morning as soon as you remember. If it's already late afternoon or close to your next dose, just skip the missed dose. Take your next dose at the usual time. Don't take double the dose to make up for the missed one. It's important to store Zenzedi at room temperature, away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. When you no longer need the medication or it has expired, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. It's also important not to flush Zenzedi down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.